Hey, it's Dr. Brian McKay of Core Health in Darien. And with the warm weather approaching, hopefully sooner rather than later, with this type of a winter we've been having with COVID-19, that we'll be out on the tennis courts. Now, it's probably been a while since you swung a tennis racket with this lack of social distancing and everything else we're going through. But I want to talk to you about tennis elbow because there are super effective ways of treating tennis elbow. I'm going to go into each one individually. You ever heard of the term IASTM? IASTM stands for Instrument Assisted Soft Tissue Manipulation. This used to be known as Graston, Graston. And Graston and ISTM are essentially the same thing. It tends to happen as the name has to get a little fancier. And hopefully people don't raise their prices as the names get fancier to treat it. We certainly don't do that. But IASTM/Graston is a technique to remove adhesions. And I want you to think about the elbow, if we're talking about tennis elbow specifically. Tennis elbow is quite painful. What happens is a repetitive strain on the elbow joint and the muscles that cross over into the forearm. And the way the racket hits, the forces gets translated when you whack the ball, goes through the racket to the hand, to those arms, the arm muscles that you're holding it. So when that happens, that force doesn't get dissipated properly and it kind of ends up at the elbow joint and you really start to strain the tissue. I just want you to picture it in your mind. Remember those little airplanes we used to have as kids where you would wind them up and you'd let them go and they would, whatever, if you wound it up too tightly, the rubber band would break. Well, the tissue gets wound up and bound up like that, and it's muscle tissue. Now, muscle tissue has nerve intervention, which is sensory and painful. So when you have that wound up too tight, we start to develop what's called adhesions. The muscle covering changes. It's a dense nerve-rich layer. And in order to imagine, I want you to think about taking a pound of hamburger meat, sticking it into a Ziploc bag, and the Ziploc bag is the fascia, the covering on the muscle, and the hamburger meat's is the muscle itself. Now you take say you took another handful of hamburger meat and put into a bag of bubble wrap. Now if you rub two bags like Ziploc bags together, it's gonna go nice and smooth. Whereas if you rubbed two bubble wrap bags together, it's going to be really rough. So when that happens, you create surface tension in the fascia. And like I said earlier, the fascia is a very nerve-rich layer. And when that gets irritated, you're going to have much more pain than you would simply if you and just had a minor, muscle pull, just a rough day at the courts. So typically, you're going to brace, which is not a bad idea. It gets the forces translated past to that. It goes to the band. If you use we call them a Chopat. Chopat's the company. Makes a very effective tennis elbow brace, and concentrated the force in one area. It helps dissipate as well. So it's a very good. It's a very good tool if you're having chronic elbow tennis pain. But what ends up happening is the fascia becomes full of adhesions, and these adhesions are very, very painful. Adhesions send the feedback, so every time you move that arm, it hurts. Now, yes, you can ice it, and it's going to provide initial relief, and that's great. You get initial relief. You can maybe play 2 or 3 days later. You're going to take nonsteroidals, Advil, Aleve, Tylenol. Pick your medicine of choice. And that's going to take the pain, but it's not going to undo the adhesions or take the tension out. So what Graston/IASTM does, it removes the adhesions. Kind of think of an eraser. You're taking an eraser, you go over those painful points, and it's not the most comfortable treatment in the world, but you would see, typically people see results immediately when it comes to that. So what I'd like to do is I'd like to take it the next step. Now, the other thing too is the lateral epicondyle takes a little bit of wear and tear. Sometimes that shifts, which puts even more pressure onto the elbow joint, causing tennis elbow presentations. By mobilizing the lateral epicondyle, you're able to really get better biomechanics in the arm, and that's going to take some tension off. So we spoke about Groston technique to remove the adhesions, which is very, very important. It's super important. Then we're talking about mobilizing lateral epicondyle. Next, we're going to introduce cold laser. Cold laser for tennis elbow is a phenomenal treatment when added in with joint mobilization and as well as the ISTM/Groston. Together, you have a really solid approach for eliminating tennis elbow. And we've been using it now with a lot of success here for the last several years. And the results are outstanding. I mean, I really can't see anything better than that. Now, if you're going to take the cortisone route, what will happen is you'll get pain relief instantly, I think, as well. But you're not going to address the adhesions, which is the underlying part. So while you get that 2 or 3 month break from pain, you're probably doing further damage to the joint itself, leading to more long-standing chronic issues with the elbow. So the approach that we take is one where it does require investment of your time, but it also makes it a lot more difficult to fix. So the combined approach of Groston/IASTM, instrument-assisted soft tissue manipulation, cold laser, and joint mobilization is probably the most effective way to deal with tennis elbow, besides stop playing tennis, which if you're a tennis player, we know that's not going to happen. I'd like to invite you to ask any question you like. We're available by phone, 203-656-3636. Core Health in Darien is located at 551 Post Road in Darien. And again, our number, 203-656-3636. Listen, have a great day, and I hope you're out back on the tennis courts real soon. Bye now.